Hi, I'm David Robson.
Hi, I'm Jelena Vesic.
Welcome to our tutorial. Is it a tutorial, lesson? I don't know.
It's a small tutorial from beautiful Purple Valley in Goa, India.
Yep.
I'm sure you've seen some of our videos from here before. They're quite popular.
Yeah, we're just sitting in front of this really beautiful shala. And on the other side, we're looking at there's all these beautiful trees. You can maybe hear the birds.
You can always hear the birds here. It's so beautiful.
Yeah. And so in honor of the workshop here, oh, there's mosquitoes too.
There's mosquitoes here, yeah.
In honor of the workshop that we're about to do, we're going to give you a secret. Yes, you've tuned into the right tutorial today. We're going to tell you the secret about hip position in primary series. And this is kind of like a hip position that shows up in like 90% of the forward folds of primary series. Primary series in Ashtanga is mostly forward folds. And if you've been practicing yoga for a while, you probably know there's different ways that you can forward bend. There's different kinds of emphasis you can put onto it.
Yeah, there's the quality of your effort, right?
Yeah, and like I guess maybe whatever direction you're putting more emphasis on. So let's do some examples. So what we're going to talk about today is partly about the hips, like what you're doing with your hips, because it's a forward fold. When we do a forward fold over our legs, then we're going into hip flexion, which just means that we're bringing the torso and the thighs closer together. That's hip flexion. And then probably part of that is going to be about the tilt of your pelvis. So you could actually do hip flexion with an anterior or a posterior tilt. An anterior tilt to your hips is when the hip bones come forward and the pubic bone goes down. And then a posterior tilt, you have to lift your arms.
Maybe I should do it like this.
This is a good way to do it.
Yeah.
And then this is an anterior tilt. So you can see Jelena's hip bones tip down and the pubic bone goes down or tips forward and down. And then a posterior tilt, sort of the tailbone tucks under and the hip bones go back. And then you can see what happens in her back as well here. With an anterior tilt of the pelvis, we see more of a curve in the lumbar spine in the lower back. And then with a posterior tilt, we tend to go towards a more flat lower back. So in Ashtanga Yoga, we're doing all of these forward folds. We're also doing this action of bandhas. And bandha means lock. And it is a physical engagement that we do in the pelvic floor. That's Mula Bandha. And Uddiyana Bandha is the lower belly. So basically, it's like squeezing the pelvic floor like you're holding your pee.
Like you're holding your pee. Like if you tune into it, and if you think about when you're in the bathroom and you either have to hold because you have to pee really badly or you want to stop your flow, you feel that there's this kind of lift up. And so those are the pelvic floor muscles that engage. And so that would be the Mula Bandha engagement. And then the other part that happens that David just mentioned is these muscle down here, your transverse abdominals start to engage. So there is like both of them engage kind of together a little bit, and then you can deepen the work of your stomach or the transverse abdominal muscle.
So if you're watching this, you can even do this. Even if people are watching, they'll never know that you're doing it, right? So you could squeeze your pelvic floor and pull back through your lower belly. Okay, when you do that, notice what happens in your pelvis. So as you squeeze, you're probably going to feel like your sits bones, the bottom of your pelvis, starts to draw down, and your pelvis tips a little bit back into more of a posterior tilt. Can you feel that? And then if you relax your belly, you relax the pelvic floor, you'll feel most likely that your belly drops forward and your hip bones come forward into more of an anterior tilt. Since we're activating bandhas through the practice, then we're going to be moving into that slight posterior tilt. We're going to be emphasizing that a little bit. Posterior tilt, there's like a lot of degrees to it, right? You could be so tilted back that you're flexing in your lower back, or you could just be and this kind of depends on where you're starting too. If you're really you've got a big curve in your lower back naturally, then you'll have to really work to flatten your back. Or if you've got a flat lower back, then you're already there. Yeah. But we're not talking about the bandhas, pulling you into this round back position. It's more subtle than that. But you do feel like more space opening up around your sacrum, and your lower back gets a little bit longer.
Yeah, I really like to try and I visualize it in my head because that's the kind of person I am. I'm a visual learner, but really like trying to feel this deep lift inside of you. And it is difficult because it's muscles that we don't see. You can't really touch these muscles. So it does take time to develop it. So if we're talking now and it's not making sense, or you're doing it but you can't feel anything, that's okay. You just keep reaching for it. And over time, you'll develop sort of a better connection with that part of your body. But for me, I feel like this kind of lift that comes up. And what I can feel is that there's like this lift that happens.
Lift through your spine?
Through my spine, yeah.
So
because of the flattening in the back.
Yeah, it always reminds me of like toothpaste, Like if you grab a tube of toothpaste and you squeeze at the bottom, how it kind of, the pressure goes up. It's like that. If you pull in on your lower belly, you'll feel the pressure start to lift. This is also part of the breathing technique, this free breathing with sound that we do in Ashtanga. That's a different tutorial.
Different tutorial, yeah.
Okay, so we're going to be trying to find how to do a posterior tilt while we go into hip flexion, in a forward bend. And actually, there's no secret to that because naturally our hips stay in a bit of a posterior tilt going forward because the hips have to come over the heads of the femurs. But what we see sometimes is people trying to find an anterior tilt in a forward bend here. Now, do you remember what we were talking about before, about when you were pulling in on your lower belly, how you could feel yourself coming into a posterior tilt? What happens when you go into an anterior tilt? Can you still find that same lift? It's very difficult.
It's very difficult.
Yeah.
The belly kind of collapses on top of my thighs.
Yeah. So we're also going to help find the contraction through the lower belly by activating the legs, especially the inner line of the legs. So you're going to squeeze your inner thighs slightly together as you push down through the backs of the heels and press down through the knees, but don't let your heels lift off the floor. Okay, so the heels have to stay down. That's where we start. And then you can feel as you push your heels down, you're also going to press down through the knees, squeeze the thighs together. Got it? And then pull in through the lower belly, lift through the pelvic floor. Good. And as you push down through the legs, you probably felt like you shifted forward a little bit onto your sits bones. See, you can see when Jelena activates the legs, the hamstrings, the tops of the hamstrings and the glutes engage, and that shifts her forward on her pelvis. That's where we want to start the forward bend. And then you're going to squeeze the bottom of your tube of toothpaste, right? And that's going to help you keep your back nice and straight so that you're not going to round your lower back. So the transverse abdominis are going to kind of support the lower back and stop it from rounding too much. And reach through your chest as you come forward. So you can use your hands in most of the forward bends in the primary series, right? You can hold your toes or the outsides of your feet. Even when one leg's extended, you can do the same. And you can use the arms to help pull your chest forward. And then you can use some of the muscles in your back as well so that you're opening up the chest. But at the same time, you're going to keep rooting back through the lower belly and lifting through the pelvic floor. And so you can see Jelena's lower back is slightly round. It's curved a little bit when she's doing this forward bending. That's fine. She's not trying to flatten the back at all because she's activating the bandhas so much. And in fact, there's probably even a little bit of space under her lower belly between the belly and the thighs.
A little bit.
A little bit. So this is the shape that we're ultimately looking for in a forward bend in Ashtanga. And it applies not only to Paschimottanasana when both legs are extended, but it could even apply to something like Janushirshasana here. The thing is that when you're doing this forward bend and you're holding this shape, even though your back is slightly round, you don't want to stay on the back of the sits bones. So as you move forward, as you squeeze, as you engage this extended leg and come onto the front of the sits bones, you want to feel like your weight is shifting forward on the sits bones, like that, so that you find the stretch in the back of the leg, in the hamstrings. If you don't feel stretch in the hamstrings, it doesn't mean that you're an expert forward bender. It probably means that you're rounding your back. You're collapsing your chest down too much. So avoid dropping through the chest and focus the movement from your hips, trying to come forward.
Mm-hmm. And if you do have stronger, can we say stronger? Shorter, tighter hamstrings, what you can do is bend the knees to find this same work. So bending the knees is a nice way to still feel a lot of sensations and stretching in sort of the belly of the muscle, which is this part. We don't want to feel anything in the back of the knee or here. This is going into ligaments, and it's not a place where you want to, tendons, where you want to stretch. But by bending the knees, I can still mimic that same shape in my back, as opposed to making the movement come by rounding my back. Over time, this is going to start to cause a lot of discomfort and pain around this part of your spine. And it's not really productive because it's not addressing the issue, which is the tightness here. So bending the knees, even if one leg is extended and the other leg's back, is a great way to find that sensation in the back of.
So strong legs, really activating the bandhas, drawing the belly in, lifting the lower belly, squeezing your tube of toothpaste, right?
Yeah.
To try to get the pressure to lift up, to keep your chest open, and then focus your forward bend by moving forward on your sits bones.
Mm-hmm. The roll.
Rolling forward, yeah, shifting your weight along the bottom of your thigh. It's not a huge movement. You'll just feel it come from the back of the hip slowly forward, but you'll feel a corresponding stretch, a deepening of the stretching of the hamstrings. And then, of course, you're stretching along the back line as well.
Yeah, it's really subtle, like these sensations, and because they're quite internal, sometimes they're not obvious.
Yeah, well, that's kind of how we started, right? We were saying there's a lot of different ways to do a forward bend. Like Jelena could bring her head to her legs without moving from the hips at all, really. She's just kind of extending the spine, or flexing the spine, right? She's all the vertebrae are articulating to bring the head down, but there's not anything really happening from the hips down.
Yeah.
Or she could try to hold more of an extension through the lower back as well. So sometimes we'll see people try to do a little bit of a back bend and then try to hold that as they go forward as well. But like we were saying, it becomes difficult to hold the bandhas in, and I think that really runs counterproductive to where we're trying to go. So yeah, there's different ways to forward bend, and there's even different ways to forward bend in Ashtanga, but having taught many people how to do this and having my own practice as well, I would say that this is kind of the secret to it. This is the essential way to do it. And these actions that we're doing with that slight posterior tilt start to really prep the body for deeper work coming forward, especially the twists and leg behind the head.
And I find that also even more basic is that by focusing on this part of the body and finding that inner work, it helps you even out the effort that you're putting, so that you don't feel that any part of like your upper body or your lower body is taking the full load, or you're only feeling the sensations there. But rather, this helps you kind of contain, and then from that place, you're stretching out in whichever direction, depending on the asana that you're doing. And it makes the work more even.
Yeah, we want to try to spread the suffering evenly through the body. Yeah.
It's true.
Okay, well, I hope that was helpful. Let us know in the comments, and then next year when we come, we can make another video.
Yeah, maybe you'll be here too.
Yeah, join us. Okay, thanks so much. Bye.